War in Healthcare, and today we're going to be talking about hiring the right people. But let's just kind of go back and do a quick cover of what we talked about at part 1. If you weren't there, we were talking really about attracting the right people. So that was from leading all the way up to the point where they click apply. Really, work has changed quite a bit over the last 3 years, let alone the last 5 years or a decade. Who we are trying to hire, the number of different generations of workplace, it isn't just millennials. We have a lot of retirees wanting to stay in the workplace a little bit longer with more flexible roles. We still have lots of boomers, Xers, and we have the next generation right on the tails of the millennials coming in. What we are doing and the roles we are trying to hire and recruit for within our organizations, within your healthcare system, within your hospital, within your facility has changed. If you've been in this industry and been in your industry long enough, think back to when you first started and the types of roles and the expectations you had for the type of people you were trying to hire in those roles and how fast that has really evolved for a whole host of reasons. Where we are trying to hire people has changed. A lot of you on this phone now not only hire people that are coming into your facility on a daily basis, but maybe you're hiring people that are going into other people's homes or going between multiple facilities. We have more and more people that are working remote and mobile than ever before. And when, especially as we start talking about healthcare, people don't stop needing doctors and healthcare services at 5 o'clock at night. And so we are hiring people to work 24/7, 365. And how we have done it has changed. It is getting more and more challenging to find the right talent, so we have to get more and more creative to do so. Hospital jobs themselves have had a sudden surge over the last handful of years. For a number of years, they were holding pretty steady, 2010, 11, 12, 13, 14, and then all of a sudden we had a huge spike in 15 and 16. Healthcare-related roles are now expected to be the #1 employer beyond the federal government by the early 2020s. Yet we are having staff shortages, and it is getting harder and harder to fill because we still don't have enough people that have the skilled roles to fill the jobs that we're trying to do, or they're not located where we're trying to fill those jobs. These staffing shortages have become a top concern of healthcare executives. Research from the Economic Outlook, Premier Incorporated in 2016, found that 42% of executives, of healthcare executives, felt shortages of staff is a larger issue than the healthcare reform. For the first time in years, that was the case. 72% of them report that the supply of primary care physicians is not adequate to meet their needs just over the next 3 years, let alone long term. And more than half are saying they don't have enough healthcare extenders, so people that are nurse practitioners, physician's assistants, x-ray technicians, the additional roles beyond the core doctors in our healthcare systems are really also finding a struggle to hire. And then a lot of organizations and a lot of healthcare systems that I'm talking to, that is the harder challenge and the harder role to fill. One of the reasons we did our first one on the enticing the right candidates to come in is because really the core issue in a lot of cases, on top of having turnover when we get staff in, is really being able to get the right applicants in the first place and getting the right people to come and apply. And we talked a lot about what happens up front the first time, from the second they start thinking about a job to the second they hit your Apply Now button. And one of the reasons why we talk so much about that, and I find branding and employment brand and candidate experience and all of the stuff on the front end so important, is because 48% of candidates are going to drop out of that application process before they finish applying. And that really even just is talking about ones that we know are starting the process. Research is showing us that upwards sometimes of as many 60 to 75% of candidates don't even start the application process because they make a decision based on the other things they see. Those strong employment brands not only ensure that people are going to apply and that it's the right type of people that are applying, but on average you're going to get 2 times as many qualified applications, which is really the key word, isn't it? Qualified applicants. and leads to a 50% decrease in cost per hire. So here's kind of the wrap-up of really what we talked about. This is a candidate's perceptions and views of this process today. And it looks a little bit different than 5 or 10 years ago, but here's just a quick snapshot of it. They decide they want to look for a new job. So what do? They start asking around, hey, you work so-and-so, what do you think? Hey, do you know of anywhere that has an opening? Post something on Facebook, I'm looking for a new job. Send an email out to friends, trying to get any information they can. Next, they take all of that information that they've gathered and anything that they have kind of in their filter and perceptions and everything else that's gone on, and they start looking at where they even want to go. So if they've heard a lot of negative, they might not even go look at your site and to see what you even have open. So then they start checking out a few career sites and determining from those a little bit more and kind of either confirming or validating the perceptions that they had. They then read some job descriptions, read the postings, and a lot of times then they're going to go check out Glassdoor or other type of feedback sites. And again, we talked last time, and I'll really encourage everybody on this call, checking out Glassdoor is really, really vital to understand what people think of your process from an interviewing perspective, but also what your current employees think, to know if it's somewhere that they would recommend other people. And then finally, they click apply. So there's a lot of places and a lot of steps in the process before they even start the application process. So today we're going to be talking about the point from apply to offer. There's a part 3 of this where we will talk about from kind of first day on and really hiring for engagement and hiring for retention. But today we're going to talk about that application process, the interviewing process, and kind of the background check and offer stage, and how we can really make that the best it can be, not only for our candidates, but also for all of our internal stakeholders. And what are some ways that we can really think about this in a little bit different way and be a little bit more strategic? So first, let's take a look. Just like we looked at, like, how do they get to the point of even applying? This is a snapshot of what it looks like from a candidate's perspective of apply now. They click apply now, they fill out that application, they wait for a response. Then they get a phone screen, then they wait for a response. Then they get an interview, then they wait some more. And then if they get the offer, then they go into background checks and pre-hire prep and all of that part of it as part of that offer being extended. From a candidate's perspective, hiring, it's pretty easy, right? You like look at my resume, give me a call, we have a conversation, I have a couple other conversations, and then you hire me. That's it. Super simple. For everybody on this call that does interviews and is in recruiting, we know that this is a very simplistic look at what this process is. But when we look at it from a candidate's perspective, they get really challenged why this feels so complicated and feels so hard and doesn't move as fast as they would like. In fact, on average, healthcare positions take twice as long as corporate and non-healthcare related positions to fill. So how do we simplify the hiring process? What can we do on our end as HR practitioners, as talent acquisition professionals, as hiring managers, as people that are involved in this process to simplify it for us to make it run more smoothly? And sometimes simplification doesn't mean cutting out steps. Sometimes it really isn't about simplifying as much as it is just being smarter with our process. Because the whole goal is to make sure that we're hiring people that are not only going to fill a seat now, that are going to be retained and stay with us in the long run. It really is focused on total talent management from the very beginning. So one of the first places to start to look at this is the application process. Reviewing your application process is something I really encourage everyone goes and does. And I don't care if you implemented your applicant tracking system 6 months ago or if you put your applicant tracking system in place 6 years ago. The application process itself is typically one of the biggest red flags, both to candidates, but to me as I'm coming in to work with your organization and we're trying to figure out why we have retention issues or why you're not getting the right number of candidates, one of the first places I always look is the actual application. How simple is it once they hit that apply now button? So they found the job, they click apply now, they start doing the application, now what? There used to be this philosophy where we wanted to make an application process that was really long and somewhat difficult because it made proof to us that somebody really wanted to work at our organization. That philosophy has really kind of moved to the wayside as the competition for talent, especially in healthcare, has gotten more and more challenging, and those roles have gotten harder to fill with really good people. And so one of the easy ways to do this is to take a look at how long your application process takes. And I encourage you, go out, actually find a job and apply for it. Ask a couple other people. You know, it's a lot of times I'll ask when I'm working on projects with clients and people that are trying to do this, I'll have my 15-year-old son, can you apply for a job and tell me your feedback? Or I would have a parent, a mom, and say, can you apply for a job with this company so I can get your feedback on how easy or not easy this process is? And we would get their feedback and hear from as many different people. And I would do the same thing. I'll go through and I'll apply for a job or 2 jobs if we have a couple of different processes so that I really know what it's like and what my candidates are going through. And I find this really especially valuable if you are a director or VP level, because a lot of times it's been a long time since you went through that process and you might not know some of the nuances or changes or things that seem to take a long time. As a rule of thumb, candidates don't really want to spend longer than 5 minutes doing an application for the whole process. And I like to kind of say, like, how long you spend reviewing a candidate is kind of how long you should expect them to be spending filling out your application. So really just keep that in mind on how the candidate expectations have really shifted over the last few years. Another thing to look at is, are you asking for more information than you actually need up front? I've seen, especially in healthcare, where the amount of information that is required to complete the application at the very early stages is similar to what we would find at most organizations. People fill out during the offer phase with the background check information and the references and all of these other pieces of the puzzle that aren't going to get done until the very end of the process anyway. And so to collect and require that data of 100 candidates when you might only need it from 5 really does not always give the best candidate experience, and it doesn't always help you the most as a recruiter because you're losing candidates because they're not having the time to go through and collect all of this information. And finally, are you using pre-screening questions to help filter out candidates so your time can be focused on the right people? We spend a lot of time doing phone screens and other type of interviews on sometimes for questions that could have been answered by pre-screening questions. If you're trying to hire somebody for 3rd shift, it's really easy to ask up front through your applicant tracking system, are you eligible to work 3rd shift? Can you work 3rd shift? Is that okay? Do you want to work 3rd shift? Yes, no, that's it. It pulls them in or it excludes them from the role. They'll still be in your system. They'll still be in your ATS. You can still access them for future roles, but it helps you match and identify the right candidates up front so that your time as recruiters, as coordinators, as HR professionals can really be spent on the right people for the role and help streamline and move them through the process fastest. What do candidates actually want? Just backing up, candidates don't have this huge, vast amount of desire of everything that they want and they need it all. What they're looking for really at the application process and through the whole process is pretty simple. They want to be able to have an idea of culture and values. And as you're going into our next conversation around interviewing, this gets a little bit more detailed. They want to be able to understand the process your organization uses to hire them or just in general. They want to have that easy way to apply, especially via a mobile device. And they want to have some feedback. And so when you send that application in, having something as simple as an automated reply that will come back that says, thank you for applying. Here's our process. Here's how we do it. If you're a good fit, somebody's going to reach out to you within the next 5 days, 7 days, 10 days, whatever that is, so they can have an expectation to either keep it open or keep it closed in their own mind. But most of all, they just simply want to feel like somebody cared. And I think as you go through the entire process, that's something we all want, especially from a company that we are going to call a career and our home, and not just somewhere we're going to have another job. So let's move into the interviewing side of this. There's all different places to start, but first, review your interview process in general. What type of interviewing does your organization do? For a lot of healthcare organizations and healthcare systems, you're going to find 4 main types of interviews, and I'm a huge proponent of all 4 of these being used. The first is phone screening. The second is video interviewing. Next is kind of that one-on-one or hiring manager or HR interviews. And the final is a team or panel style interview. Phone screening is one I think we do pretty regularly at organizations, but sometimes we don't do it for the real value it can provide. And so being able to ask some of those more cultural fit questions and really dive into questions or details that we have before they move into the rest of it is really key. It's the first glance that a candidate has into our organization, and it really is the first bit of perception around what the engagement is going to be like and what the culture is really like at your company that isn't static, that isn't the career site, that isn't the job posting, that isn't anything else. It's their first person-to-person interaction that they're going to have and will really reflect the values and the type of organization that they feel it is. Next is the video interviewing, and we'll jump into that. Finally, the HR or hiring manager interviews, again, really key. It's important, even if you're doing those panel interviews, to make sure that somebody has a little bit of one-on-one time, especially with different type of communication styles and different personality fits. Sometimes there's conversations or questions that come up that are better suited for a one-on-one environment versus a full panel. So let's talk a little bit about video interviewing. And we at Cornerstone doesn't offer video interviewing, but we have partners that do. And video interviewing is really a key part of a process, especially when you're looking at something like healthcare, which is running 24/7, which has a number of people that are going to be involved in the process, in hiring decisions, in interviews, that can't always just say, I'm sorry, patient, I have to step away. I have an interview I have to do. And the same for the candidates. Sometimes getting everybody in at the same time doesn't always work. And so video interviewing has been incredibly useful in healthcare facilities, in places that have really high demand type of roles and roles that work 24/7, 365, and for people that are trying to be hired. And so a lot of our conversation around video interviewing or digital interviewing is about the cost savings that you have when you don't have to fly somebody in. In healthcare, I think there's that added benefit of just the time factor. You have a nurse manager on the PEDS floor that has to review all of the people that are going to be hired. Well, they can't always step away to be doing back-to-back interviews, but they can, in between patients, when they have some time, pop onto this and review some of the interviews, pause it if there's an emergency and they're needed back again. And so there is a different level of accessibility that this type of technology provides. Here's basically what it does at a glance is from a recruiter perspective, from a team member's perspective, interview, panelist, hiring manager perspective, a candidate will have their interview done, and on the left-hand side, you can see a whole list of all of the candidates. You could see the question that they're asked, watch that one question, jump to question 3 if that's the one that's most important to you, jump to question 6 if that's the one that's most important to you, and go from there, rate, add notes, review, and be able to provide feedback for anybody else involved in the process. Hey, maybe when we bring them in, we need to dive more into this. We need to dive more into that. From a candidate perspective, it gives them the ability to answer all of these type of questions in a comfortable environment without having to necessarily take time off of work, and it helps really streamline the process. Companies that roll out video interviewing often cut their phone screening time and their hire time down by as much as 30 to 35%. The next conversation, regardless of how you're doing the type of interviews, is how are you training your interviewers? Do the interviewers have guides to follow to help them know what they're looking for? Very often, we don't put together, behavioral questions. We don't put together interview guides, and we're bringing people in and asking them to participate in the process that they're just not comfortable with. They're not trained in interviewing. They're not exactly sure what they're supposed to be asking, so they do their best, and then we're making hiring decisions and we're making judgment calls based on sometimes people that aren't exactly sure what they're even looking for. And beyond that, from a legal implication perspective, have you done the legal training with them to know what is and isn't allowed? It's amazing when we've asked interview teams and panelists that do not come out of recruiting, even hiring managers, and we say, which of these questions is illegal? Which of these questions are not okay to ask in an interview question? The vast majority of people just don't know. And so making sure that you're doing training on what is and isn't allowed and the language that they're allowed to use is really key and really important. Next is making sure you have clear goals in mind of what's trying to be accomplished. You can interview just for interviewing's sake, and you can have people give feedback, but what are their exact goals? Is there somebody that you are really wanting to make sure that they're looking for the clinical side and the clinical skills? Is somebody else really focused on patient activity and patient care and how empathetic maybe somebody is going to be to your patients? Do you have somebody else looking at cultural fit overall? How well are they going to work in this department for this manager with the rest of this team? Does everybody know what they're even supposed to be looking for and what's trying to be accomplished? And finally, are you talking to people and asking them to talk about the organization and the role in the way those candidates are expecting it to? Are we selling our company as we go through the interview process, or are we simply telling and asking? Today's workforce has evolved, and everyone on this call knows finding somebody to fill healthcare roles is not an easy job. It's not an easy task, and it's continuing to get harder. And when we are fighting against ourselves by not doing employment branding and having the conversations and talking about what we're already doing as systems and practices in order to meet the needs of what that new workforce is looking for, then we're making it even harder. This is what people are looking for when they've done research and they're asking, what do you actually desire in your next role? Why would you be leaving? Why are you moving? In some cases, yes, it is compensation. For the most part, when we actually look at people that are looking at it from a retention and long-term perspective, it's the training and development. Are they going to get ongoing development? Are they going to get ongoing training? Are they going to be staying static in the same role on an ongoing basis? When you look at this six, kind of the desires and what this is, are you talking to the top two, the hours and how that works and the flexibility or how the schedules are structured there? Are you talking to the training and the learning and the development opportunities that you're providing to the staff? All of these conversations should be part beyond just the job description. Next, what are the interview strategies just overall? Do you have that behavioral interviewing process? Do you have standardization? It's amazing as we go into organizations, the lack of standardization, even with the same role. And from a regulatory and a liability perspective, healthcare systems are really strict about standardization and making sure they're following the rules. And so it's really important to do so in the interview process. And creating a consistent process makes it easier and is an improvement for everybody involved. It makes the hiring manager and the decision maker have an easier playing field to be looking at. It makes a level playing field for all the candidates. For a recruiter, they know there's consistency. And from an interview panel or an interview team, they know what they're doing every time they walk into that type of a role. During panel interviews, at least one person on a team should be a coworker, and somebody else on that panel or that interviewing team should be from a partnering department with who that person might interact with, in addition to the hiring managers and HR. Next is looking at how you're measuring and accounting for soft skills, cultural fit, etc. Clinical skills are huge, and they're vital, and they are very important. But more and more soft skills, technical skills are needed in our healthcare systems and in these type of roles. Who's actually responsible for that, and at what step in the process are these getting measured? At some organizations, that's done very early on at the pre-screening and the phone interview. At others, it's part of the panel interview, and at other companies, it's part of the hiring manager, the final decision maker's interview. And there's not a right place to put this. The challenges and the challenge to you is just making sure that you have it somewhere and that it is clearly defined that somebody has responsibility or a host of people have responsibility in how that is getting measured. How do you share information about the roles and responsibilities? Is it just simply handing over a job description? Or are you talking about it from a broader perspective and what the day actually looks like, a day in the life of? And again, just going back to what we just talked about, are you talking about what the people actually want to be talking about? Is your interview strategy and approach about selling or telling why somebody should be working there? The interview process and how all of these pieces get done is really vital. It's the stage where people make a lot of decisions. It's where they decide if they want to work for your organization as much as you're deciding if you want them to work for you. It is impacting their employee engagement once they come on board. It's going to impact retention. We know that people will make some of these decisions during the interview process, even if they get an offer and start. We know a decision's being made very early on if they think it's a place they're going to be able to stay long term. On the flip side, those panel interviews and the involvement of other people on the team and other people on the staff equally impacts engagement. It helps people feel like they have a voice, like it improves team morale. It allows people to feel like they are part of something a little bit bigger. Next, background checking and reference checking. This is a smaller section, really just highlighting some of these things. Legislation regarding the care of patients really varies state to state. If you are hiring from different states, if you have facilities in different states, background checks, reference checks, I really encourage you to make sure that you're digging deeper during interviews and background checks. Because the impact it can have once you hire somebody, as anybody probably on this call knows, is even greater in a healthcare type of setting than it is in a corporate setting. Without the responses you get and how good your background check and reference checks are only as good as the companies you have doing them. If you're getting old information, incorrect information, it can actually be used against you in future legal cases, and we're starting to see that pop up. So make sure that what you're getting and you're asking the right questions about what your background check providers are digging into and what they're looking at, and make sure that with your legal department internally that you are aligned and that this is okay, and just having those conversations. Again, making sure that your talent acquisition goes beyond just recruiting and is a partner to the business throughout the organization. The biggest part of this that I want to just talk about is making sure that all of this is done at appropriate timing in the process and that it is being done with the utmost respect for the candidates involved. I've been at a meeting that was a number of job seekers at it, and they were sharing stories of, the point where the background checks are done often is post-hire or post-offer, but before first day. The same with reference checks. You know that there's a verbal offer being extended and get permission to do the reference checks, and pending reference checks, pending background checks, everything is okay. What we are starting to find more and more is happening is because of things like social media and LinkedIn, organizations are going around the standard reference checking, and they are reaching out to current bosses without permission, and people are losing their jobs. And they're having retaliation or having some other things. It's now actually not uncommon for organizations to not even be able to provide and to not allow employers to be able to provide reference checks outside of, yes, they worked here, no, they didn't work here, yes, they're eligible for rehire. And so if you have a case where you have a candidate that has that type of a situation from a reference perspective, just make sure you are aware that this is a changing trend that we are coming up against more and more, where managers and coworkers are not allowed to provide anything more than that. And the same with background checks, just making sure that they're done at the appropriate timing in the process. There's no reason to do them before you know somebody is going to be made an offer. Or very early. We've even seen it where people get background checks and want to do reference checks before they do in-person interviews. Finally, just extending offers. Okay, you've got the job, right? That's the exciting part. You get to tell somebody that you are giving them a job. When I was a recruiter and I was running TA teams, this was by far my absolute favorite part of the job. There's nothing greater and more exciting than being able to call somebody up and extend an offer and welcome them into your work family and have them join you and know that you're making an impact on their family. I mean, in a lot of cases, they might make more money. They're going to be coming into a positive work environment where maybe they weren't, or working where they're not commuting so much. They're getting better hours. They get to do their dream job, and you get to be a part of that, and you get to be the one that tells them, hey, here's your dream job. Here's what this is going to be. It really is the starting point to help them get comfortable with where they're going to go in the organization. The more organized you are at this stage, the better it's going to be. It makes them feel more comfortable. It makes them feel just more prepared to walk in, and it just builds a greater sense of confidence, which helps long-term with the engagement side of it. Next is making sure you have clear expectations, details, timelines, make the process smooth. Again, just pointing back to what we talked about earlier, the more organized you are going into it, and sometimes it's okay to call and say, hey, look, we have an offer, we're putting it together, it's coming, it's forthcoming, or here's, maybe you share what you think it's going to be. Is that okay? Is that where we're thinking? Are we aligned? Here's what this is. Is there anything that's going to stop you from accepting this if we move forward? And then going from there. Once that verbal acceptance is there, is discussing day one and the onboarding process. What is that going to be like? How is that going to look? What should they be doing? How do we work this? What should I wear? What time should I show up? Where can I go get lunch? Like all of those little details. So to kind of wrap all of this up, we've talked a lot about like how we look at things and all of this. It's really talking about the why. And the why is really comes down to the ROI for the stakeholders, which is everybody that is involved in this process. Making your interview process simple, and by simple just meaning having a process, making it defined, making it more strategic, making the application process, just streamlining this has really great ROI. And one of the greatest areas of ROI is it does come back down to retention and making sure we're hiring the right people to start with. Healthcare has a turnover rate of 17% on average. I know a lot of people on this call have turnover numbers significantly higher than this. I know a lot of conversations I've had with people in healthcare systems, the numbers are more than double this. And so it comes back to really making sure that what we're doing from the very beginning is doing everything that we can to help impact this number. Because bottom line, turnover rate is impacting our patient satisfaction numbers. It's impacting our employee satisfaction numbers, all of which is impacting our fiscal numbers and the money that we have coming in to actually do our jobs and run our business. So how this process really gets improved, let's kind of walk through the 4 main areas of improvement. From a candidate experience perspective, having this process easier allows them to apply with a little bit less effort and less stress. It allows them to get through the process, and it's going to speed up how long it takes you to hire. That in itself touches all 4 of these, but from a candidate's perspective, there's nothing worse than just sitting and waiting. And so it helps move that process along. From a recruiter experience, having some of the standardization is going to allow you to focus on being a partner and managing a process, not necessarily managing all the details, and really getting more strategic with your role and what you're doing within the organization. The next comes to the interview team experience. When we start looking at panels and having conversations with them, a lot of times one of the feedback we get is, I don't really know what I'm supposed to be doing, so it doesn't feel like I'm adding a lot of value. When we create standardization and we create a process that's a little bit simpler and more streamlined, it allows everybody to get a little bit of buy-in to make sure that they feel like they are a valued part of the process and they understand why they're taking time away from their busy jobs. And from a hiring manager perspective, we're hiring candidates faster, they're retaining longer, and they're typically more engaged and satisfied once they are hired when we start the process right from the first time. Overall, nearly 3/4 of companies are planning to alter their strategies around recruiting starting in 2017 for a whole host of reasons, especially around interviewing, but the number one, or in part, is to reduce the risk exposure. And so from a little bit more holistic perspective for your organization, the reduction of risk is going to be really key and important. So we talked again today about this middle piece, and I want to make sure there are some questions that are coming in, and I encourage you, if you have questions, you want to ask specific questions about things that are going on or challenges you have in your hiring and interview process, please send them over through the Q&A. I'm going to try to cover as many of these as possible, but definitely encourage you to send some through. The next part of this is going to be kind of what we brushed on. We talked through, again, the importance early on of enticing them to even apply in the first place. We talked through today about how to streamline and make this process a little bit more strategic from an interviewing perspective and a hiring perspective. And then part 3 that is coming up in a couple of weeks is going to be about engaging and retaining that talent. And so how does everything that we've talked about, how does all of this impact this? Let's talk a little bit about onboarding, and then we're going to dive into how you can really develop referral programs, succession planning, internal mobility, and also a little bit deeper dive. I just brushed on it today, but the impact of employee satisfaction on patient satisfaction, which all of us with the way payments and everything else come into play, patient satisfaction is really important and key for us in healthcare, and so we need to understand how those all link together to make sure we are really being as strategic as possible in our roles and helping facilitate this, our organization. And so I'm going to jump over into some of the Q&A type of questions. So again, I encourage anybody else on here to please send through, and we will get through as many questions as possible. So the first question that is coming through is a recruiter is saying that they are hearing does not want to relocate as a typical response after the on-site interview and the extended offer. What are some of the real reasons we are seeing these declinations? Because I assume that that this is just the politically correct excuse, but not necessarily the real reason. Well, let's start this up. We'll go back a little bit. When we're talking to people that decide, or we're trying to recruit people that are going to have to relocate, it's really important to be really clear up front about what that looks like. If you are a healthcare system or a facility or a location that typically has to be relocating candidates and enticing people to move, there are a couple other things that we didn't really talk about last week or this week that's really important to do. And one of them is to sell your location and do that really early on. On your career site, make sure you talk about what it's like to work there. And a lot of time the chambers do a really great job of starting to put some of these programs together. But put a page on your career site. I live in Milwaukee. So I live just north of Milwaukee. So companies here might have a page like what it's like to work in Milwaukee because people have perceptions. And so it's like, here, let's show us all of the new restaurants that are here and all of the sports teams that are here, and that we have some of the top ranked schools in the nation and in the suburbs, and, you know, talking what the quality of life here is, that our average commute time is 13 minutes. There is no rush hour traffic. And, you know, you have some of these conversations and you put that information out, and you also ask early on at every stage of the process, why are you open to relocation? What would make you okay? What are you looking for in your next town? And asking questions about the relocation aspect of it. And going into that side of it, so you understand what their motivation is. If they come in and you are bringing them in for interviews, there's two parts of this that's really important to do if you're having to do relocations. One is to make sure that you take a little bit of time, or, you know, depending on the level of candidate and what it is, but if you're relocating them, they're typically a little bit more challenging candidates to fill. It's important to have somebody kind of show them around, give them a tour, take them out to dinner, take them to lunch, give them a sense of the community and what it's like to work there. Second is allow them to bring a spouse, and make sure if they are married that you get the buy-in from that spouse on what it's like to live and work there. It isn't uncommon that we've seen in some healthcare systems that have a particularly hard time recruiting. There's a hospital I'm thinking of in particular that was really struggling to recruit anesthesiologists and some specialty type of roles. And so when they did find candidates that they were strongly considering and really interested in, when they flew them in for the interview, not only did they fly them in, but they flew in the spouse. And they would often set it up for a couple of days and allow them to do kind of a long weekend. They'd set them up with a local realtor, allow them to take a look at what property was like, learn a little bit about the schools, give them a couple of gift cards to go out to dinner a couple of nights, check out some of the restaurants, and just get a feel for what the community was like when they were having to relocate a whole family. That very quickly changed some of the challenges that they had because they were able to get buy-in from the entire family. If you're bringing people on site and extending offer, and then that's why they're declining, it likely is that they don't want to relocate for your organization. And so it's maybe not as much they don't want to relocate, but there is something that didn't feel right or feel comfortable about your facility, about the people they met, about how the interview process went, about the community wasn't really talked to as much. If that is what you are hearing, I definitely would make sure you go back through what we've talked about today and really look at how you're selling these roles and how every single person touching this interview process is presenting your organization, presenting the company and what it's like to work there. I would also go check out Glassdoor. If you have problems with interviews or declining offers, Glassdoor is an amazing, amazing resource for us to be able to go in and read what people really thought of the interview process. And so I really encourage you to do that. And as an aside for the person that sent this question over, if you are still really at a loss, why don't you reach out to me? My email is on here. Let's connect one-on-one, and we can talk through some stuff in a little bit more detail than we can get into on a group chat. Any other questions that are coming through that anyone might have? Again, please feel free to send them over. One other question that has just come through is around the Glassdoor feedback and checking that out and how to do that. You don't necessarily have to register. Anybody can go on and take a look at that. Read through what your employees are saying about it. If you have employee satisfaction surveys, I would also read those as well. They're really great resources. And if you are going through and trying to really get a gauge and understand where your process might have gaps, or I'm going to kind of combine a couple of the questions here, where you have some gaps in your process or where you might need to improve, a really easy place to start with is to do a candidate satisfaction survey. 4 or 5 questions. Just say, how was the interview process? How was the application process for you? How was your on-site visit if they were a relocated candidate or a potential relocated? Did you feel like you got all your questions asked? Answer just a handful of questions and see what comes back. It'll really help you kind of hone in. And if you do multiple multiple things, you can ask this very generically to people you decline, as well as people you extend offers to that decline you, or people that you extend offers to and accept and start. But just send it out and do a quick overview of, here's what we're doing, and we're trying to just improve this. We want to be better. We're an organization that is constantly trying to improve. And one of the areas that we're trying to improve is our candidate experience and our interview process. And if you just give us a little bit of feedback, we would greatly appreciate it, and that's kind of the end of it. But that will help you if you really are at a loss and don't know why you're facing some of these challenges. That's a really great place to start.